So when we talk about life force in practice, we want to support the inflammatory process. We don't want to inhibit it. We don't want to say, we know better. We want to find a way to work with the body's approach, because the body has been doing this for millions of years. And if you go back historically beyond that to all life forms, it's going back millions, hundreds of millions, billions of years of intelligence, of interconnectedness, of interwoven brilliance that came through to today. We don't have to redo that. We can work with it, understand it, and make it better. And I believe that there's incredible power in us understanding the life force and working with it. Botanical medicine, the foundation of what I do, the foundation of what this conference is all about working with the life force to support physiological function. Like I said, from TCM, Ayurveda, that's Chinese medicine, TCM, traditional Chinese medicine, Ayurveda, naturopathy, homeopathy, chiropractic, they all have this essential principle that the body has this innate ability to heal itself, to regenerate itself, to maintain harmony. And in Chinese medicine, my focus of study in my graduate program is concerned with the behavior of qi. And so qi is this quality, the vital function of organs and organ networks and tissues. What is the quality of them? That's the qi. And medical therapies are used to provoke the qi to reorder itself, to bring order, organization, flow to the energy, to the qi that is the vital function of our living tissue. So what does this all come to? It comes to following the body's lead. And when we talk about acute respiratory disease, there's been a number of studies that have come out showing that clinicians are finding that the most advantageous approach for preserving life is not to go in and just tell the body what to do, but it's to follow the body's lead, to use the minimal amount of invasive interventions as possible to help somebody through a sickness. More intervention does not equal more quality or quantity of life, right? We spend more money on healthcare than anywhere in the world, and yet we don't have this incredible, benefit that we see in how we handle health and disease. It's not a thing where you intervene more and you would do better. We have to rethink that.